Well, we're happy to be here today, Doctor. Maybe you could share a bit about the overall philosophy of the Hoag Institute here.
Sure. The Hoag Orthopedic Institute is a single specialty hospital. It's an orthopedic hospital, so all of our focus is on orthopedics, and we perform major procedures here like spine surgery, joint replacement, hip and knee replacement, orthopedic trauma. All of that is performed here.
I understand you have a unique process when people come in for a surgery procedure. They actually work with a navigator. Could you explain what that process is?
True. We have our own orthopedic navigators here. These are registered nurses, all of whom have orthopedic background, and they work with our patients for elective surgery before, during their hospitalization, and then after they leave as well.
Could you show us that department?
Sure, absolutely. Come with me.
This is the Navigator Check-In. This is the place people, I guess, would come here first?
That's right. So when they come in for their elective surgery in the morning, they will arrive here and they'll meet their navigator.
Okay. I think you're going to bring one of them out so we can talk to her. Oh, here she is now.
Yes. This is Frosty Ryan. Rob?
Frosty, hi. Good to meet you. Hi. Nice to see you. So explain a bit about how the Navigator process works.
Yeah, we are basically their health care provider that walks them through the system. In essence, quote, a guardian angel to guide them through the pre-op screening process. We also collaborate with other healthcare professionals to provide a continuum of care and hopefully enhance the overall patient experience.
Obviously, if we're coming in for surgery, there's a bit of anxiety. Do you help to diffuse a little of that?
Yeah, we do. We work on being the primary contact person that they are able to contact us throughout their entire stay or post-discharge regarding questions, concerns, anything that praises regarding their care or difficulties through any situation. They can always call us. We give them a number, and we're here. We're available for them anytime.
I know as a nurse you like to take care of people. I imagine this is very rewarding to deal in this particular facility here.
It is rewarding. I think overall one of the best things about it is that we are available to decrease patients' anxieties, to be one primary contact person for them to always be able to come back to.
Okay, so this is where the patient would come next with their navigator, I presume.
That's right. This is the pre-operative holding area where the patients first get prepared for surgery. And we have the executive director of perioperative services, Gabrielle White, and she's here to talk with you about that.
Great. Doctor, I understand you have to actually go take off your suit, put on your scrubs, and do some surgery today.
That's right.
We thank you for showing us around the hospital. We appreciate you giving us a tour today.
Take care. It's my
pleasure. Thank you so much. Good to have you with us today.
Bye-bye.
Gabby, hi. So let's talk a bit about the pre-op procedure. Obviously, somebody's been walked up here by the navigator, and then what happens?
Okay, so once the patient arrives in the pre-op department, they're greeted by our clerical coordinator or one of the nurses at that point. They will be checked in and then go into a private interview room, and that's where the registered nurse will have the patients get changed, wait for them there. Then they come back in, and then they'll just go through some of the documentation that is really important for the day of surgery in the operating rooms. Go through all the documentation quickly with them, make sure everything's accurate, see if there's any concerns the patient has at that point as well, and we'll address those concerns. We're really looking at their physical needs, mental needs, social needs at that point also. And then vital signs are checked. Then once all that's completed, the consents have to be accurate. Any changes, we have to get those corrected. Then we'll take the patient over to their bed where the nurse will then insert the IV, because they have to have IV set up ready for the operating rooms. And then from there, the patient's pretty much ready to go. They'll have their surgical site prepped as well, usually, especially for a hip or knee replacement. And then the patient will just wait for the anesthesiologist. That's where they'll get to meet the anesthesiologist. They'll have another quick assessment from the anesthesiologist and questions. That's the time when the patient can ask questions too about anesthesia. The OR nurse will meet them, do a quick assessment too. They may see the surgeon before surgery again, but not always. And then they're taken into the operating rooms.
It sounds like they're going to be meeting several different people, really a team of people. So it's not just you, not just one or two. There's a lot of people that are working up here.
There's a lot of people involved in the care of the patient at that point, or all the way through the perioperative and nursing spectrum of this.
What's the time, from the time the navigator brings them in to the time of their surgery? Is there a kind of an idea about how long they'd be up here?
Yeah, we try to get the patients in 2 hours before their scheduled surgical time. That usually does have the patients waiting a little bit, but we do like to have the patients in a little early. It gives us time to collect everything we need, get the patient prepared, and then hopefully if the surgeries are running on quicker than expected, the patient's here ready to go earlier, which is really nice too.
All right. You seem to have a lot of high-tech equipment here, pretty much what we would find in the average patient room. You pretty much duplicate that, it looks like.
We do. We have to have all that. We do for just the patient monitoring before surgery, and then the electronic medical charting as well. So in the pre-op area, there's not as much involved goes on, but once you get into the post-op, that's where there's a lot more monitoring and charting.
So from here, the next step would be the operating room.
Operating room, and then after there, they go into the post-anesthesia unit, where they recover for maybe 1, sometimes 4 hours, depending on the patient's needs, and then they'll be discharged to the nursing floor at that point.
Okay, well, we've seen the pre-op process. You've explained that to us. I guess the next place we go is the operating room.
That's right.
All right, let's go. Lots of things here in the operating room, and one thing on the screen, I thought it was a big screen TV set. I thought maybe we were going to watch a sports event while the surgery went on.
Yeah, that would be tempting for some of the doctors, I think. But no, this is actually our PAC system. It's a digital X-ray retrieval system. So anywhere where they have digital X-ray images stored, and we have secure connectivity with that system, whether it's physician's office or, for instance, Hoag Hospital that we're affiliated with, we can, when we're doing surgery on a patient, we can pull that patient up in that system, and then we can project the images onto the screen that the surgeons will use during their surgery. And it's just so much easier. In the good old days, or it happens today, physicians bring their hard copy X-ray images with them. They mount them up on the view box on the wall. But this way, we can pull up an array of images that may be stored for this patient.
So, for example, if one of our viewers had surgery 5 or 10 years ago at Hoag Hospital in Newport Beach, and they're having to have that thing looked at again or redone or whatever, you can actually pull it up right here in Irvine from Newport.
If they had X-ray that was, or an MRI or a CT scan, anything like that that's digitally stored, we can go and access that patient's medical record, pull up the images, and then expose it onto the screen for the surgeon to use in surgery.
Yeah, I understand that this was a previous hospital, and you folks did an extensive rebuild of all these operating rooms and really this whole area.
Them, yeah, we made them a lot bigger as well. Orthopedics takes up a lot of everything, a lot of space, a lot of trays, a lot of people. So yeah, once when we had to rebuild, we did have to expand the size of some of the operating rooms, and then by adding the technology we need to do our job efficiently and well, and to provide that continuum of care by, for instance, pulling up X-ray images, we had to do a lot of work, but it's all paid off. It's what we need, and that's how we operate.
I think that was about an 18-month rebuild process from the old hospital to this one. And my understanding is actually the Orthopedic Institute really is its, if you will, its own hospital with its own everything.
It is its own hospital within a hospital, that's right. It's still affiliated with Hoag Hospital, but it's a hospital that's partnership between Hoag and some of the physicians, a good group of the physicians, and so far it's going to, it's been a very successful thing, and we just love being here, love taking care of our patients, and just love the fact we have our own space to focus on orthopedics. That's really what the surgeons wanted, because they know the patients will get the best out of that.
Great. Gabby, thank you so much for showing us
You're
around.
very
We appreciate it.
Thank you.